It's Mari McInerney from Croaky here, and we are at the end of the Equally Well Symposium in Melbourne. Everybody else has left except Dave Peters. Dave, would you be here we go on the stage. Would you be able to introduce yourself and your role here?
Certainly. My name is Dave Peters. I am a consumer or someone with lived experience of mental illness, and I've been, joyfully involved in preparing and organising this two-day symposium full of equally well opportunities and some issues as well.
And what's your actual role in as part of that organising?
I'm now recently been appointed as co-chair of the Implementation Committee, which I'm not sure if we're going to call it Implementation Committee anymore. We might just call it Committee. But
because the implementation is implied?
Well, just that I guess part of the difficulty with saying implementation is that it almost says to the people who have signed on to the agreement, the Equally Well position statement or whatever it is, I forgot what the name of it is.
Consensus
statement.
Yeah.
Thank you very much.
You're welcome.
It implies that they're answerable to us somehow. And although we're funded by a government body, they also are funded by a government body. So I guess they're no more answerable to us than we are to them.
And is that a critical issue here about the entire thing with the Equally Well consensus statement, is that you've got a lot of buy-in, haven't you?
It is. It's a very complicated issue, I think, because it's across the whole of Australia. We've got probably a good 100 funding bodies, ultimately funded through the federal government, but throughout the various means and ways and pathways, the funding, I guess, is not piecemealed, but certainly parcelled out, which normally I think over the years hasn't been a problem. But when trying to introduce a grand sweeping change on a small budget means that you're suddenly trying to work with 100 stakeholders and trying to get them to agree on a consensus is fine. That's worked quite well. Everyone's really enthusiastic about the need for change. But actually making the change happen in a deliverable timeline is the next challenge.
And that's
did I actually answer your question,
yes,
or did I avoid that?
Well, you avoided it, and yet that was the answer, perhaps.
Okay, good.
So I think that's why we were here for these last 2 days, was to walk along that road further.
It was, yeah.
She said, drawing another analogy.
Yes, I think that it was really great to have the members of the New Zealand Te Pau organisation, because I guess although their organisation New Zealand is different from ours, they're a bit further along in the process of getting some change happening, and I think it was fantastic to get to hear from them, I guess, about some of the implementation stuff that we've just talked about. You know, it's how do you get beyond the agreement stage into actual change, and who is in charge and who reports to whom, and
what are they doing that you want to get to?
That's a very good question. I think part of it is the normalising of the issue and spreading the awareness that physical health outcomes are so bad, and there are a lot of issues for people with a chronic or long-term mental illness. There are many people living with mental illness who don't know that. The dominance of narrative about mental illness treatment is that you will get medication and you will take the medication and you will get better, even if you're deeply involved in sort of the recovery model, which is all about psychosocial change and sort of addressing those social determinants of health. You're still going to run up against this model of biomedicine where you go to see an expert, they prescribe a treatment, whether that involves medicine or not, and you may or may not experience a lessening of your symptoms, which somehow equals better, but doesn't really address the side effects of symptoms or the other problems that medicines sometimes cause.
And that was a big issue here for the last 2 days.
Yeah.
How did you feel that a symposium like this was able to manage that conversation, and did it actually get somewhere?
Look, I think the conversation itself was handled pretty well. We gave it. I say we. There was some time allotted to allow for the conversation to happen, but perhaps some of the people in the room felt like it wasn't given sufficient time, and I think that's fair enough. because it's the established narrative is still very much that sort of biomedical model, even including the recovery model and sort of consumer movement. There's still that sort of general acceptance that pharmacology has a role to play, and that it's difficult to go through a severe mental illness without having some involvement in pharmacology. And I forgot what I was trying to say,
about advancing those kind of discussions at a symposium like this, because there was a whole group of people. There were clinicians, there were service providers,
yes,
and there were people with lived experience. So what was it like for you to observe that in action? Did you actually feel it was raising issues in a different way than you've seen before?
Certainly I haven't seen this kind of discussion happen with such a wide audience, which was really exciting. People from high-level Department of Health type people through to academics, policy people, through to practitioners, dietitians, exercise physiologists, GPs, psychiatrists. So that was fantastic, seeing such a wide range of, I guess, experts or professionals. But we also tried to acknowledge the expertise of lived experience in the room as well, some of whom played dual roles of being a physician or a academic expert, policy person, and someone lived experience. So I think the role that this forum had in allowing the discussion amongst a wide variety of audience was great, and I think that was successful. I think trying to give it the time that it deserves, given that it's still a really big issue, I don't know how that goes, because it's we're not going to change the narrative overnight. We do still need to have the discussion, but we can't make the whole conference about that discussion because we're not hearing any other points of view. And I think that it could get a bit angry if we started making the whole conference about this one point.
One of the observations made to me, though, was that physical health seems to be opening up a conversation on human rights for people with mental health, with mental illness, in a new way. Have you observed that? Do you think this focus is giving you fresh vigour?
I think so. I think we're lucky in Victoria in that the lived experience sort of workforce is quite well established. Seeing quite a few familiar faces from Victoria, consumer sort of people in the room the last 2 days. But meeting a whole range of people from interstate that I'd never met before was fantastic. And I've forgotten the question, sorry. The joys of live television, everyone.
Isn't it? And on a Friday night. This is Friday night entertainment, people. It's that question of whether human rights for consumers, for mental health consumers, they're more on the table through this focus on physical health. For example, we saw a lot of challenge to psychiatry here around seclusion, restraint, which you don't hear at a lot of mainstream mental health conferences.
No, you're more likely to see that in a human rights or an academic paper or perhaps a mental health law symposium. But physical health and equal access to physical care and addressing physical health needs as a mental health consumer or patient was one of the issues that came up, and I think that it's fantastic that it did. Hearing from the Mental Health Complaints Commissioner, Lynn Coulson-Barr, about some of the complaints that they've received from her office. 7,000 odd complaints last year, 7,000 phone calls, 2,000 written complaints, plus. Human rights are still a huge issue, and they're perhaps not getting the attention that they need. Hearing that people on psychiatric wards or hospital wards getting denied access to television, communication, mobile phone, denied access to other medications, even if they're staying in the same hospital, denied access to the specialist appointment they had, from a year ago that they've been waiting for. Because they don't want to escort them up to the appointment. To think that kind of stuff is still so widespread is terrifying. And you think that if it was happening in another part of medicine, say if you had a broken leg and you were denied a phone and denied TV and denied visitors, you weren't allowed to leave the place, and then you were denied medication for your other illnesses, for your chronic health issues, there would be an uproar. It would be all over the papers, because how dare they refuse people equal right to the stuff that they're allowed. But for some reason in mental health, although you can make a complaint to the Mental Health Complaints Commission, I don't know if that actually results in change. The complaint gets answered by the Commission. The mental health facility that the complaint is about has to respond to that complaint, but I don't think that actually stops them doing it again next time, and the next time, and then 2,500 something written complaints last year, and growing every year, shows that there are some major problems going on. Human rights are being infringed. Yeah.
One of the New Zealand speakers, Caro Swanson, she raised the idea that when Equally Well first came up, she was worried about it, and she's now one of its great champions, but she was worried because she said it just added another layer of she was worried it would add another layer of scrutiny. Did you have concerns about it, or?
Yes and no. I mean, I can see her point of view in that the idea that you're still, I guess you've got another thing to be measured by your doctor. You're not seeing someone new. You're just seeing your current team of specialists or healthcare providers, and they're just going to do some extra things with you. Does make it seem a bit like, well, we're going to take your measurements today. We're going to put a tape around your waist and to see if you've gained or lost any weight. And based on that, we'll either blame you for being fat or celebrate your losing weight. So that bit is, sounds outrageous and doesn't sound very helpful at all. I guess being on the inside of the movement, I can sort of see a bit more about it being, not even saying holistic care, but about addressing the risks of deteriorating health as part of your treatment. And, back to human rights again, allowing access to the ability to address those problems if you're ready to make those changes and if you want to make those changes. And even just being informed about the side effects of treatment, whether it's compulsory or not. Yeah.
And so where do we go from here? And this is you putting your hat implementation stroke committee on. What's next, do you think, for Equally Well? This is the first time you've all come together?
It's the first time that we've had such a conversation with the healthcare sector and consumers broadly. Beyond the in writing the consensus statement, there was a large sort of community consultation and service sort of consultation done. But this has been the first opportunity to get together with people from service using through to practicing to policy and academic, chief governing body type thing. Oh gosh, it's the end of the symposium, end of 2 days, and I'm knackered. So let's just say I don't really know. I know we're meeting next week to sort of do a debrief and work out sort of where to from here. The last few weeks have very much been a focus on let's get to the symposium and we'll worry about that afterwards. Not that I'm saying they're disorganised, just that it's this has been a huge organising effort on a small group of people.
Because mostly this is on top of your day jobs, right?
Oh yeah, absolutely, absolutely. There's only a couple of support staff employed on the project who are dedicated just to the role of Equally Well. Everyone else has a full-time day job, including me now. So it's a that was a big change. So I guess I can't say really. I can't answer that question.
Walking out the door, though, how will you feel? Not just relief.
Okay, there's a little bit of relief. I've been looking forward to the end of the day because I've been a bit stressed about making sure that everything goes well and feeling like I don't stuff up my role. But invigorated, really. Seeing that people are just as enthusiastic and passionate, whether it's about how bad things are, whether it's about the possibility for good change. I'm just glad people are interested. if they're interested in talking about it, if they're sharing information on social media, if they're talking to their friends and colleagues, great. Part of the problem is lack of awareness. So the more awareness that gets out there, I guess people can then start to look at whether the message is right or wrong and whether they agree or disagree. But I think first the message actually needs to get out there. So good or bad, publicity is good.
That's a perfect ending. Thank you very much, Dave.
Thank you very much, Murray.